The sole purpose of this video is to orient you to the new Philips Heart Start AEDs, to demonstrate proper AED pad placement, and to demonstrate operation of this machine. In no way are we teaching, correcting, or altering CPR skills or treatment algorithms. The Philips Heart Start automatic external defibrillator is now on all of the Radnor Fire Company fire and EMS vehicles. There is also an AED in the AED cabinet in the front hallway of the fire station. These Philips AEDs are to be used for adults, children, and infants. The indications to apply the AED pads are unresponsive patients, patients in cardiac arrest, patients in respiratory arrest, or patients in severe distress with indications of nearing cardiac or respiratory arrest. The Philips Heart Start AED is in a hard red case. This case has an indication window. You should see a green flashing light indicating the machine is ready to be used. Open the case. The layout of the AED is the pad connector port.
Plug-in pads connector inserted.
The child treatment key slot. The green ready indicator light. The green off-on button. The information button. This button will light blue and will give you verbal promptings for CPR. A yellow hand off indication button. This button will flash yellow when the machine is analyzing rhythms. The orange shock button. This button will flash orange when the machine is prepared to shock. And the speaker. Inside the case, on the other side, is the gray case holding the pads, as well as the child and infant treatment key. You will also find a spare case of pads and a spare AED battery. The same pads can be used for adults, children, and infant. The manufacturer recommends the pads applied to the apex and base in adult patients. Using the same pads for children and pediatric patients, we will do anterior and posterior pads. The children pad placement will be for children under the age of 8 years old or less than 55 pounds. To operate the Philips Heart Start AED for an adult, you will open the case, you will turn the machine on, then apply the pads.
Clothes from patient's chest.
The machine will analyze and will give you the prompts to shock or begin CPR. At the pause, you can touch the blue information key for voice prompts to coach with CPR. If shock is advised, the orange button will flash. Make sure to clear the patient and shock. Begin CPR immediately after shocking the patient. For children under 8 years old or less than 55 pounds, you will apply the pads to the front and back. Turn the machine on. Insert the treatment key. Then you will apply the pads. The machine will give you voice prompts according to child CPR. For pad placement references, you will find references on the pad case, on the individual pads, on the AED machine, and for children and infants, on the key.